Good morning, and welcome to our continuing series, Interviews with Disciples and Devotees. Today again, we are honored to have with us Dr. Pachegaonkar. Namaste.
Namaste.
The subject today is very interesting, health enhancement. And you use the word enhancement very specifically instead of improvement, let's say.
Yes.
Why?
The reason is like when we say we want to improve, that itself suggests that there is some deviation or some retardation.
Okay, very good.
So health enhancement would be always a positive term.
Excellent.
See, before we understand like what health enhancement means, it is better we understand what we really mean by health. Because health is not something like which can be calculated only with the chronological age or physical abilities or mental abilities. It is much beyond that. Basically, this body, human body, is animated by the vital so that it can become a better instrument under the guidance of mind to evolve as a better and better human being with ultimate goal to be divinized. So that what we call this is the higher purpose of life. All other things like success in the career or good amenities, these are all the means, not the end. So when we just assess how the person is progressing on this path of a higher purpose of life, that will give us the exact idea how much healthy the person is. So illness definitely will distract the person from this real progress because of the pain and disabilities at physical level, mental level, or even intellectual level will definitely cause obstacle in the free progress of the person.
And just between us, to be clear, this free progress of the person and including the body is towards the transformation
Exactly.
of the physical
Exactly.
body.
Yes.
And that is yoga.
Yeah,
Or at least
exactly.
it is the integral yoga of
Yes.
Sri Aurobindo.
Exactly. So here at every level you have to be healthy. At body level, at vital level, at mind, as well as and then the deeper aspects. At the same time, every level is important. Nothing that like this is important and that is less important. So even at physical level also we have to see that everything is in perfect harmony. All the tissues, organs, the systems, they should function in a perfect harmony. Then only this instrument can be employed for higher purpose of life. So there are a few basic things which I advise to everyone. And the most important would be breathing. The breathing controls everything in our physical as well as mental level. Or it can be the other way, that mind can be projected in breathing. Simple example would be like if someone is having fear, sudden fear, so breathing goes shallow. So would be breathing fast. If someone is in anxiety, grief, again breathing gets affected. So we advise everyone that you just be aware of your breathing. You put your breathing in such a fine rhythm that the vital gets rejuvenated. We get enough oxygen at physical level. The best way to breathe would be what we call abdominal breathing, diaphragmic breathing, where you breathe in completely and then slowly breathe out completely.
Yes, it's not pranayam per se, but it is a way of. I'll tell you something interesting. My guide, my Upaguru, was Aurobindo Basu. And one time he said to me, within a few months, you're going to have some difficulty with breathing. And he said, don't have to do pranayam, don't have to hold your nose. All you have to do is breathe deeply and quietly and exhale slowly.
Exactly.
Just what you're saying.
Yeah, wonderful. So sometimes we ask person to take help of that Om chanting. That also is an excellent tool to cultivate this type of breathing. We suggest that like breathing has to be like 1:8. Like if you breathe in completely, then slowly breathe out, and this proportion time required would be 1:8. That would be ideal.
Breathing for 1 second, releasing for 8 seconds.
Like that. So it can be like 3 seconds you inhale and then 24 seconds you
24
exhale.
seconds.
Like this.
Okay.
So if you are able to maintain your cycles like 4 cycles per minute or even lower than that, you will get the best tranquility in the world. It would work like a best tranquilizing tool. So first of all, the breathing. Mainly the person need not be always conscious of the breathing always. Means one need not be distracted from other objects. But we have to cultivate that we have sort of a deep, slow breathing. On an average, we have 15 to 16 cycles. So we suggest that you have even a smaller number of cycles per minute, and that would give you wonderful energy. It will be like recharging.
4 being 4 or less being the ideal.
4 would be the best, but then maybe at that time you may not be able to do some other work. You will be focused only on breathing.
Yeah, okay.
So even if it is like 11-12 cycles per minute also is fine.
Cycles, we mean
Inhalation and exhalation is 1 cycle.
Okay, good.
Cycle.
Yes.
After breathing, we give importance to sleep. Because sleep again is something which helps in recharging your energy. It is like a natural hibernation at every level. Like your body is almost under suspended animation. Totally, the animation is all suspended because all the 5 senses are under suspension during sleep. Means a light touch you can't feel. The hearing also is under suspension. Even vision, even taste, and even olfaction.
A mother speaks of becoming conscious in sleep.
Yes. That would be ideal. But at that level, you know that almost every time you are able to maintain your equanimity or tranquility, even when you are working. That is the best yogic stage, I would say, where the equanimity is always there. Constant phase of equanimity you have. There it is wonderful. Your energy discharge and recharge is all balanced. And there are instances where Mother and Sri Aurobindo for days together, formally they did not sleep even for a minute. They were working constantly. But the reason is that they have attained that level where they were able to maintain that equanimity, the equilibrium.
Yeah.
But for an ordinary person, the sleep is must. But that is what I say suspension. Suspended means whenever it is required, it can again come back. Like suppose someone is asleep and if someone is shouting around, definitely person will be awakened within seconds. Same, some sort of a prick or a pain definitely will arouse the person. So it is like what we call a temporary suspension of animation of five senses, but all involuntary systems are working in the body, and that really gives wonderful hibernation and freshness. Then this sleep has to be on an average for adults around 7 to 8 hours. That would again, the requirement would vary depending upon what work the person is doing or how the season is. In children, it is more. In infants, it is like 12 to 14 hours. In growing children, it would be like 10 hours to 12 hours. And then adults, 7 to 8 hours sleep should suffice. But that sleep should be again a timely sleep. That is what we suggest, that midnight should be the midpoint of sleep. That, and then before sleep, your stomach must be empty. For one reason, that if food is churning in the stomach, the remaining body is asleep, and whereas stomach is working vigorously. So that creates a turmoil, and that person will never get sound sleep. Though person might be asleep, the senses would be, but body will not get that refreshing feeling on waking up. So we suggest to have dinner 2 hours before going to bed, and midnight should be roughly the midpoint of sleep.
So we've had breathing and now sleep.
Sleep. And third would be water intake. This water intake, fluid intake in any form, should be adequate so that you have enough fluid to flush out in kidneys. Then you have enough fluid even to sweat freely if you need to. And you need to, what we call, make the mucous membranes or maintain the mucous membranes in a moist condition. So that much hydration has to be there, especially in climate like tropical climate in India. The fluid requirement will be so much because of the dry heat. So you have to see that you hydrate yourself well. Regarding water intake, we suggest that you take ample of water, enough water or a fluid in any form, half an hour before meals. So that ensures a free flow of fluid in the body, and before you eat and then go on churning food in the stomach, the body is hydrated well, and which can sustain the level for more than 2 hours.
Now, if you have to take vitamins or something that they say after meals, you have to take it with water or fluid.
No, that is negligible quantity of quantity.
Okay. So the small quantity doesn't matter.
And we don't say that don't take it after food. We don't say that. We suggest take earlier. And in addition to that, with food, if you take some fluid, no harm.
Okay.
Only if you don't take before food, then your body doesn't get it for 2 hours. So we ask them, we don't give instruction that don't drink water with food or after food. We suggest you drink much earlier so that you may not need it. But if you feel like some sort of supplement or liquid medicine you are taking, you can take even after food. There is no problem. Then our criteria would be you must have a free, clear urine, and you must have enough fluid to sweat if it is needed, because that's the best coolant in our tropical climate. Sweating is the best coolant for the body. So enough fluid. And then we suggest our food. Breathing, sleep, then water intake, and the fourth point is our food intake. In food intake also, like timings of food intake, the pattern of food intake, and then the quality counts. So in food we suggest that everyone should take food after start taking after sunrise, and then terminal part should be around sunset. Half an hour plus or minus, more or less this should be good. Then you ordinary person can have 3 divisions like breakfast, lunch and dinner. So breakfast should be around like before 8 o'clock. Then lunch can be midday, somewhere like 11:30 to 1:30, 2 o'clock.
Okay.
And dinner should be before 7 o'clock in the evening.
I'm doing one thing right. That's very interesting because I've always felt that an early dinner is best.
Yes.
Not
Yes.
8, 9 o'clock
No.
for dinner.
But then you're going to bed gets delayed. Because 2 hours you should not go to bed when you are having meals. Then eating slowly. What if these meals you eat slowly, one should not take in haste. Then eat 40% component of your meal should be fruits and vegetables together. 40% component should be that.
So when people say don't eat fruit with vegetables, that's not correct.
People may have some objections for the combination with certain vegetable like combination. Because they say that's concept of fruit salad. So 2-3 fruits together you should not eat. They say. But otherwise, in general, fruits and vegetables which are harvested in that season are the best for the person in that area. In general.
Yeah, we talked about apples last time, I remember.
Yes.
Yes, so it should be harvested in the season.
Yes.
When
yes.
you consume it.
So slow eating, and then comes moderate eating. You should not overeat. So best would be like 80%, 75 to 80% of your capacity you can eat. So timely eating, slow eating, 40% vegetable component in it, and then moderate eating like 75% to 80%. And then the quality counts. Like food should be always fresh. It should not be hot. When you eat, it should not be hot.
Hot?
Hot, temperature wise hot.
I see.
Because by the time it reaches your stomach, it should be of body temperature. Otherwise, that is commonest cause of cancer in esophagus. The people who tend to eat always hot food, they don't like cool thing or cold thing.
So hot here is temperature, not hot as in chilies.
Yes, of course, yes.
Only temperature.
Temperature.
I see. So it can be mildly warm?
It can be warm, so much mild that by the time it reaches our stomach, it should be coming to our body temperature.
Okay.
If it is warm in mouth, no problem.
Okay.
Below the throat, it should be our body temperature, because mainly carcinoma esophagus, we have seen the commonest incidence is in people who are habituated in eating hot food, temperature wise. So it should be like coming to body temperature before we gulp. This is the idea. So even for tea we suggest that up to throat hot tea is fine. But that's why more hot means you just slowly sip it off, so that by the time it descends, it comes to our body temperature. So this would be the best. And then the food should be fresh, not preserved, or what we call with preservatives, or sometimes they keep in refrigerator also, and for days. In refrigerator, little bit of shelf life is better, but not eternally. Like you can't eat one thing cooked today and eat for 4 or 5 days or again. So it should be fresh food, timely, slowly taken, and moderate quantity. So this should be the food habit. Then there are few more things, like we advise everyone that you always keep few moments of respite for again recharging of energy. So when we are working, so while working also, if we work fast, in haste, in what we call with impatience, then also we get tired, and sometimes we become low in vitality, and then we succumb to illnesses. Very simple example I would give. Suppose someone is participating in 100-meter race, and someone is participating in 4,000-meter race. The strategy has to be like in 100 meters, one knows that we have to run for say 10-15 seconds and then stop. So one can definitely go with full vigor. But when you have to run for say 4,000 meters, then one has to maintain the stamina and therefore run slow. So you can cope with that. So this way, even day's work also, one should start early, work more, but very slowly. You have to enjoy working. And then one principle we tell is dwelling upon present. Dwelling upon present is the best tool to overcome the anxiety. Because suppose I am taking bath, so I must enjoy taking bath and forget everything in the world that time.
Yes.
Suppose I am taking my food, eating, I must just relish my food.
This is very Zen.
Yes.
Because
yes.
the Zen masters say this.
Yes. Yes.
When I walk, I walk.
Exactly.
When I sit, I sit.
Exactly.
But you
present.
sit and you're thinking about 100 things.
Correct.
But when I sit, I sit.
Because we have seen, the commonest ailment with the sedentary habit people is spondylitis. And they are getting spondylitis because they are not aware of the movements and jerks. Simple illustration would be like, see, someone who is driving will not develop spondylitis. Whereas the other people who are traveling with the driver, they will be prone for spondylitis because they are not alert.
Is spondylitis curable?
Yeah, it is curable in the sense, it is not curable only with the medicines. The person has to participate in strengthening the muscles and ligaments around the spines. So that is what we say, you have to maintain them well. So there is no chance one would get spondylitis.
I do have one question about people who, because so many people are glued to computers these days, how should one portion out one's time at the computer? When does one take a break?
See, best thing is body is a wonderful apparatus in this state. Like if we have some odd posture and if load is coming, body definitely creates some sort of a discomfort in that area. And body makes you, suppose I am sitting here and my buttocks, that area is not getting enough blood supply. So there would be definitely sort of unease, and reflexly I will just raise myself for 1 second and sit. And that raising for a second itself will give enough blood supply. So I have to allow my body to understand the situation and react accordingly. So even see, I'm sitting on a chair as a homeopath. We generally sit, listen patiently to the patient, and at least on an average 8 to 9 hours a day I'm sitting in one chair.
Yes.
And last 40 years. Last 40 years. And I started using computer because the homeopathic software came. Somewhere 92 I started using computer. And we use computer almost for 7-8 hours intermittently, of course. But why should one get it? Only thing is the whole musculoskeletal system has to be actively sitting, because sitting also has to be active.
Yes.
It can't be you just leave body at the mercy of gravity on the chair like a log. One should
Yes.
learn how to sit like a live being, and then the tone is maintained. So no chance of getting spondylitis. Absolutely. And they say it is incurable because medicines can't cure it. It has to be the person's active involvement in regaining the tone in the musculature, and that itself will reverse it. So it is reversible. Yes.
If one has arthritis also with spondylitis in other areas of the
Yes.
shoulder.
Arthritis contributes to the placidity of musculature. Otherwise, management is just same. Yes.
Okay.
Like say the worst cases are what we call ankylosing spondylitis. There the bones themselves are brittle and distorted, and they're binding. So there one has to take more efforts. That's all. But without patient's efforts or active participation, it can't be reversed.
Interesting. Well, this has been very, very interesting, and looking forward to next week's talk. Thank you, sir. Namaste.